Hi, everyone. Welcome to our ALF training webinar series number 14. And today we're going to talk about a couple of recent surveys and go over what happened, what they got tagged for, and what we can learn from them. On the webinar with me is my beautiful wife, Cheryl. How are you doing, Cheryl?
Hello. Good.
How's my audio coming out clean?
Clean. Yeah.
Good. Well, I mean, not much to talk about. We'll just get right to it. Let's see if I can share my screen with you. And do you see it here?
I do.
Okay, it was an ECC facility.
This is 32, right?
Yep, 32. And the survey was conducted on September 14th. And they got cited for, we'll just get right into it, resident care and social and leisure activities. Based on observation, activities calendar review, and staff interview, the facility did not provide activities for the residents living on the west side of the building during the survey. The findings include that the schedule showed the activity staff is off on Sundays and Mondays. A review of the activity calendar for the unsecured unit west side of the building showed at 10:30 a.m. exercise, 11 a.m. coupon clipping, 1 p.m. bingo, and 2 p.m. porch chat. Ooh, that's a lot of stuff. Okay. Observations during these times showed these activities were not provided. So, so they had it listed.
So they
and just didn't
interviewed.
do it.
Yeah, but they interviewed staff B at 3 p.m. on the same date, and the staff member stated that the activity staff called in sick and the activities were not done. And unfortunately, that's not a good enough excuse. So if you have an activities person or someone designated to do it, whether it's a caregiver or that's someone's position, you still have to make sure those activities are being done. And that's something they do look for when they come and do inspections. So you should have found somebody else to do the bingo, the porch chat, or the the administrator themselves should have done it, taken the initiative, just to make sure it was being done, because it is required.
Right.
And it's something that you just can't brush under the table.
Well, I'm curious because in the regulation is.
Why were they doing it on the west side?
Yeah, but
12 hours a week.
12 hours a week, and that's what I said. That's a lot of activity. I mean, look at they did 10:30 exercise. So let's say that's 30 minutes. 11
But it's
a.m.
probably a large community. I mean, that's what people do, Clay.
That's what they do. No, I'm not.
If you look at ours, we have all those things too. It just magically happens.
What I'm saying is that the requirement is 12 hours every week, and it's got to be done in 6 days because Sunday is okay. So it's got to be 2 hours a day. But yeah, I mean, did they calculate what the hours were for the whole week? I mean, where's the violation? If they did all their hours that they're required to do, it doesn't say.
You don't, but it doesn't matter when they come in and they see that they're going to ask for the activities calendar, and if it's not being done, they're going to get upset with you and they're going to write you up for it.
No, I completely understand. But I'm just curious, like, could you have argued that? Could you have said that we're well within
yeah, if you had already done 12 hours within, you're well, but they should have documented it. They should have been documented, or something happened on the facility's part before the surveyor just finds out at 3 o'clock they haven't been doing these. And that's just covering your own behind.
Yeah. All right.
I mean, I'm not saying you're wrong. I'm just saying it's just something as a facility owner or operator to look out for, that if there is an issue with the day, to make sure you document that it's not being done, but it's being rescheduled, say, till the next day, and let your residents know. There's just ways to protect yourself. Yeah,
and really it starts with having some sort of system in place so that if somebody does call in sick, because if a caregiver calls in sick, we know what to do, right? We have to have the shift covered. So we do what we have to do. So if you just had some protocol in place to say, if an activities person calls in sick, what is the protocol? The protocol is maybe call in an extra caregiver, maybe,
you do it yourself.
Yeah, like the marketing person becomes the activities director, or the administrator makes sure that those things are coordinated. And
Okay, but
have a
if you look
backup
at
plan.
this a little bit deeper, it says that the residents living on the west side of the building were not provided activities. So was it that they were being provided activities on the east side of the building? You know, there was something. There was just something more to it. I think that tipped off the surveyor to kind of go a little bit deeper.
Yeah, I don't know. I
So
mean,
what happened? The west
well,
side
they might
wasn't
have,
getting anything.
but they
So
might. The activities person might only run activities because it said something about the unsecured unit, the west side. So the secured unit, the memory care, they
may
probably
have had
have some sort of caregiver run activity or something that's done, and it's not
right.
combined. They don't use the memory care activities. It's different. So there's different programs. It just so happened that this program here, because I mean, memory care, you're probably not going to give them scissors to cut coupons and stuff like that. I have to assume. I mean, I don't know. Everybody's different. So the next thing they got tagged for is medication labeling and orders. Based on observation, record review, and interview, the facility failed to place an alert label for change of direction of medication for one of four residents.
This
Observation of
isn't.
medic. What's that?
This is something that can be easily, forgotten too. The alert label.
Right.
That's something you should
Observation.
audit and check.
Um, failed to place an alert label for change of direction. Right. So, right, because the staff could still be reading the label that says give one tablet a day, but now the new order says 2 tablets a day. So you need to put some notification change sticker on that medication label, so they're not reading the
Right.
label. They're reading
So if your pharmacy doesn't do it, you can go to Office Max and get those fluorescent brown stickers and put
Right.
change, MOR on it and stick it on the prescription
Yeah,
bottle or pack to alert the staff that there's been a change.
change order.
That's just safety,
Right,
definitely.
right. And yeah, also just getting the habit as well, but of reading the MOR instead of just the label. But still, it has to have the label regardless.
Right, and that's something you should do in your audit. Matching up the prescriptions bottles
Right.
and prescription packs to the MOR, making sure that the words are the same and nothing's changed. And if it's changed, then you need to go find the order itself and make sure you have it in possession, and then put the alert sticker on and change it in the MOR, update it wherever it needs to be updated.
Right, right. So the staff DD said she was not aware that alert label was not on the medication. So she just didn't know that it was not on the medication. Okay. So class 3 violation. Next is physical plant and safe living environment. Based on observation and interview, the facility failed to maintain a safe living environment for residents. The findings include large cracks on the ceramic tiles. Room number 22, ceramic floor tiles cracked again. Black scuff marks noted on the wall. The maroon leather and fabric couch in the common area. Large black stains on 2 cushions. Room 20, 11 cracked ceramic tile floors. Sounds like a lot of neglect on the maintenance. Cracked sink bowl. 18 cracked ceramic floor tiles in room 23. Room 17, a large black scuff mark noted on the wall. So I think if this were happening in just one room or one tile or something like that, but it sounds like a lot of disrepair.
Even in the dining room, there's cracks. It's just they maybe need to maintain a little bit more maintenance.
2B, a hole noted in the wall. So I mean, they just started to go through every room now, and we're going to look for all of the issues. Hole in the wooden baseboard, brown stains noted on walls, vinyl bath mat stained orange, black stains noted on plastic shower. So during an interview with staff E, he stated, "I do not make rounds and I do not have a maintenance log. I expect the girls to tell me if there's something wrong or needs to be fixed." So that was like the maintenance guy, I guess.
Well, then staff, the facility needs to have a maintenance log or put some sort of protocol in place to make sure that these aren't slipping through the cracks, or have the administrator walk the facility and look for things like this.
Yeah, our maintenance guy is on speed dial.
Gosh, on too much speed dial sometimes.
All right, so
that could have been prevented. So this maintenance, it's important to maintain the facility. And obviously,
like if we had holes in the walls, and I mean, the residents will be calling me And
I think they said something to us once. Do you remember, like maybe 6 or 7 years ago, one of the hospital beds over in Building 3 in the large room had put like maybe a mark in the wall, something so minor, and I
oh
remember they
yeah, yeah,
questioned
yeah,
us.
yeah,
Remember,
yeah,
and
because the hospital bed going up and down was scraping the
we're
wall.
scraping the wall,
Yeah,
and it wasn't
and
that we were neglecting. It was, but no, it's true. Just things like that can set a surveyor off and start looking for things.
but
And
then we also
saying
found a solution because the staff would always push the hospital bed back up against the wall, but we put a 2x4
foam.
across the base of the wall to keep it from being pushed all the way up against the wall. So once we came up with that simple solution, then we fixed up the wall. And so anyway,
Didn't you also take those foam floaties from the dollar store? Those
put them
noodles?
on the bars. Yeah.
We put them on the bars too to have the little buffer. Those are some creative ideas.
All right. All right. So class 3 violation. Then next tag was based on inspection and record review and staff interview. The facility failed to ensure all required information was in the facility contracts for all 3 of the residents reviewed. Contracts were reviewed for resident 2, resident 10, and resident 4. A review of these contracts showed there was nothing written informing residents and the responsible parties that the residents will be assessed on admission and every 3 years or after a significant change. That's the health assessment. So it
Right.
basically says that it has to be health assessed for upon admission and then significant changes in every 3 years, a minimum every 3 years. An interview was conducted with the administrator. She reviewed the contract and stated she does not have this information in the contracts. So go ahead and make sure you have that statement saying that, about the health assessment form needs to be done. All right. That is that. So let's skip over to 61. Cheryl?
61 I have. Yep.
Okay. Are you seeing, can you look on my screen? Are you seeing, okay,
Yes, I see
where it
61.
says admissions criteria is the first tag? Okay.
Yes.
All right. So an unannounced relicensure survey for an ECC facility, they had deficiencies based on observation. So it's admission criteria is 1. So based on observation, record review, and interview, facility failed to ensure 1 out of 7 sampled residents did not require nursing services. Failed to ensure that they did not require nursing services, specifically an indwelling catheter. So resident 2 had a catheter. Resident 2 was
Right. So
observed, propelling her wheelchair in the activity room. A clear tube hanging below the chair for an indwelling catheter was also observed. She confirmed that the resident had an indwelling catheter. She stated the resident had a catheter to assist in the prevention of urinary tract infections. And the health assessment form said that it had a history of recurrent UTIs. The assessment listed assistance with toileting defined as emptying the catheter bag. So during an interview with the resident's representative, she stated the resident needed to have the catheter and that a home health agency checked her twice a week for any concerns relating to the catheter. During another interview with the manager, she acknowledged the aforementioned findings and stated the facility was in the process of obtaining their ECC license. So they didn't have their ECC license at the time. I see. She was unaware that indwelling catheters were not permitted under standard ALF licensing.
Right.
So,
And this is something you should watch for on us. I mean, she didn't know, but I'm just saying to everybody, you should watch for it on assessment. And where we see catheters coming out the most, and you actually have to probably double check and things, or when they're in rehab facilities. Wouldn't you agree?
yeah, it's
They
just
have
it's there.
they want to discharge them with a catheter, so you have to
Right.
make sure you see that on the paperwork and let them know in advance that they cannot come into your facility with a catheter if you're not able to perform these services under your license.
Right.
We've dealt with that several times.
Yeah.
And then sometimes they get to the facility and they still have the catheter in. You have to, go back and have it removed and but you need to make sure that they can function and live properly without the catheter in your standard license facility.
Mm-hmm. Yep. So that'd be an LNS or an ECC license.
Right.
Okay. Based on record review, I mean, I guess if you had a nurse, could you? I mean, do you think they had a nurse?
But this is their license. They can't do the nursing
fair enough.
services.
I know. Okay. Next tag was medication records. Based on record review and an interview with facility, failed to ensure medication observation records were accurate and up to date for 1 of 5 sampled residents. Resident number 1 was reviewed. The MOR for resident 1 was reviewed, and the following omissions were identified. Okay, there's a long list of things here. So, milk of magnesia, blank. They had blanks on the initials, right?
Right. On certain, just summarize it. On the various certain dates, they did an initial for these different medications. So, right then they didn't know whether the person had taken the medication, if the medication was out, what happened, and it wasn't documented. So the manager acknowledged that these omissions were made and that the MOR had not been initialed by the med tech each time this resident received their medication during the 3 p.m., 11 p.m., and shifts in on multiple different dates. Mm-hmm. So really there's nothing to do. It wasn't signed for. The surveyor obviously wrote them up, and there's, no paper trail. There's nothing. They don't really know what happened, whether the resident was given the medication or not. So this is something that you can prevent by doing a daily audit of your books to make sure that the med techs are signing and that the residents are indeed getting their medications, or if they're refusing them, that it's documented.
Mm-hmm. Yeah, I mean, that shift change, or when you take over a shift, when the new person comes on, that's every med tech, if you build that system in, like, hey, let us know if somebody forgot to initial those doses, and then we can at least follow up with the person beforehand, alert management, let them know that, hey, there's a blank here, and then at least that it can be covered. I mean, 1 out of 7, this one sheet, they had all these blanks. So must have been the same employee. So class 3 violation. Next was staffing standards based on record review. Facility failed to ensure 2 out of 3 sampled residents staff had freedom from communicable disease, including tuberculosis, documented based on exam by healthcare provider within 30 days of hire. So you want to review the rule, Cheryl, basically?
Right. It's just they didn't have the proper forms in the files, and we've done this on a previous survey. It's just important to make sure you know what employees should have and that they have it in there. And they have that annual TB test documented.
Survey, yeah. New hires, new employees need to have a freedom from communicable disease, and tuberculosis done within 30 days of hire. And the TB needs to be renewed every year. But the big issue with the freedom from communicable disease is it needs to be signed by a healthcare provider. And you can't just, right. It has to be done, it can't be done by a nurse. It's got to be done by a doctor, right. Like a physical examination, right?
Right, and not by the health department usually, unless you get the physical and someone's signing it, but not the RN.
Yeah, they lump them together here, like for example. But they're 2 different things. Your mic's making a lot of noise, Cheryl.
No, I mean you are too. So.
Okay.
I'm not trying to fight with you, but I'm just sitting there thinking how annoying your mic sounds.
Oh, that's nice. Okay.
No, I'm not. I'm really not moving. So.
Okay.
All right. Let's carry on.
All right.
Staff and service.
Yeah. So go ahead.
Yep, they didn't have, they reviewed records and they found that a lot of the direct care staff did not receive the in-service training within 30 days of employment pertaining to emergency procedures, incident reporting. Those have to be done within 30 days of employment, and they need to be in their file. So they just neglected to have those done for some of their staff, and they interviewed the manager, and the manager confirmed that the training had not been completed, and they didn't have any documentation presented to present to the surveyor. So those are just things that you need to really be on top of when you hire somebody new, that there are certain requirements that they need before they start and within the first 30 days of employment. And then, annual and there's different milestones too. So things just to be careful is to watch your employees' records and make sure that you have everything in there timely. It also continues on that they didn't have the HIV training, which was required within 30 days of employment too, and that they didn't have the DNR training. So basically, they kind of missed that whole staff and service training that needs to be done. We'd like to have it done before 30 days. We do it personally before we have someone start working. That way we don't have to worry about it or chase the 30 days. But I know that's not realistic all the time. But it is if you use our training website, because it's very easy and they can do it from home. They can do it on the job. They can do it while their fingerprints are processing, because you have that time where it takes a few days. So there's different options to make sure you're in compliance. Maybe these people should get a checklist too for each file to make sure that they have all the requirements in there.
Mm-hmm. And the DNR training, same thing. So they missed a lot of training, but this is all in-service stuff and pre-hire stuff. That you should be able to if you use some sort of checklist. Like I said, my ALF training, we have a subscription package that's amazing. And, even break things up into monthly payments. So you shouldn't have to really worry about it if you use our training website for one. And then before they even start work, you just get them to get the healthcare provider to sign the form that they're free and clear of communicable disease, and then the TB test done by the health department or whoever it is. But just get it beforehand, because once you hire them, you're going to forget. And that 30 days will come ticking, and, you'll be out of compliance. And you can't fix that. I mean, the date of hire, and then you got the date of the TB test and the date of the healthcare free of communicable disease dates are set in stone. So those things are just there. So let's see here.
Well, let's wrap
DNR.
up this one, Kalei.
Yeah, DNR, we got that. That's it. So I think that's long enough for today. Let's just break here. And let me get back to our screens. So basically, that's it. I just wanted to say one thing. We did create an award, and it's called the let's see if I can share my screen. Quality Care Service Award. And oops, where is it? Are you seeing the service award, Cheryl?
I'm seeing large facility membership.
Oh no, that's not it.
No, I see you.
All right. So the Quality Care Service Award is for caregivers that you want to award and recognize them as being outstanding employees. And basically, if you're a member of the Care Association, you can award one of these to one of your employees once a month. And it's a nice thing. We can do an interview with them. We put them on our website and recognize them being from your facility. They get it's a nice pin, and they can wear it around that they're proud of. And they can also they also get a certificate from us, and it's good. It's nice recognition of what they do. We're excited about it, so start looking for it. We're starting to launch it now. Quality Care Service Award for Care Association members. The Care Association is the association for quality assisted living, careassociation.org. Okay, and I think that's it. Thanks, Cheryl, for joining us today.
Thank you.
Okay, bye.